Hi, everyone. I just wanted to briefly introduce myself and then share with you one key idea that I wanted to bring to the discussion today. My name is James Smith. I'm a general practice and public health doctor from the University of Cambridge, and I've previously worked for the National Health Service Sustainable Development Unit and Public Health England on sustainability. And I currently lead activity in Cambridge on environmental sustainability for our interdisciplinary public health network, Cambridge Public Health. So I'm really pleased to have been asked to speak today. I was invited, when I was invited, I was faced with a dilemma because I haven't actually been on a plane for 15 years. This has been my choice for environmental reasons, but has also been because I haven't needed to in my personal or my work life. I haven't until now been presented with work opportunities outside Western Europe where I thought the value of the work might outweigh the carbon cost of flying. So I've done work trips to Paris, Brussels, Geneva, and even Copenhagen, and they've all been quite straightforward. But Athens is more challenging. But I was still reluctant to get on a plane, so I thought I'd give it a go coming overland. So I booked a journey from the UK to Greece, traveling over 3 days through France and Italy, involving 6 trains, a ferry, and a bus. Well, that was the plan. Unfortunately, there was a landslide in the Alps that shut the train line between France and Milan, so I had to rebook the journey to come through Switzerland. Then on the way, my train from London to Paris was delayed because of someone throwing themselves on the line in England. So I missed the connecting train and had to stay in Zurich instead of Milan, and I had to rebook the rest of my outward journey, including my ferry to Greece from Italy. In the end, I arrived 2 days later than planned, but I arrived here just in time, and I'm very grateful to be here. So this short story about my journey shows how disruptive environmental and social factors can make changing how we do things really challenging. It highlights how important it is that we think about risks and system shocks as we change our systems and policies to meet our long-term goals. This is the case for healthcare as well as travel. So I have one central idea which I would like to introduce to the discussion at this stage. It is my view that we should give greater attention and preparation to the potential for sudden shifts in policies which are currently conceived as longer-term policies. In short, I think we should bring our long-term policy challenges into our preparations for short-term threats. So to illustrate this, I want to use the long-term policy goal of reaching net zero carbon in the NHS, the health system in England. So in the NHS, we aim to reach net zero by 2040 for the carbon footprint under our direct control, and 2045 for the broader carbon footprint, including the rest of our supply chain. So there's increasing work going on in the NHS to reach these goals, including establishment of a national green NHS team, all hospitals having green plans, and a net zero supplier roadmap, which expects all our suppliers to the NHS to align their own decarbonisation plans with these targets by April 2027. These actions are obviously based on the current targets and aim to achieve progress over the coming 2 decades. But what do we think the coming 20 years will be like? We've just heard and we know that there are going to be worsening environmental disasters, and they're going to keep getting worse until we get to net zero globally. And they may well escalate as environmental tipping points are crossed. It seems to me highly likely that society's response will also be non-linear, and the speed of action demanded will vary substantially at different points of time over the next decades. I suggest that we need to prepare for this and work out how to make positive, transformative change in healthcare policy at moments of social tipping points. Even if you disagree with me and think steadier, slower change is more likely or more desirable, I would argue that the risks of badly done rapid change are such that it is worth preparing for. So during the COVID pandemic response in the NHS, we saw how the positives of rapid change, for example, the rapid rollout of video patient consultations, were also accompanied by negatives such as the worsening of chronic disease care and widening health inequalities. This may have been to some extent avoidable if we'd done greater preparation with a broad system-wide perspective encompassing longer-term issues. And so I want to finish by giving an example of asthma inhalers, which is an area I've worked on. So metered dose inhalers for asthma are disproportionately high carbon because they contain hydrofluorocarbon propellants, which are potent greenhouse gases. However, there are low carbon alternative dry powder inhalers, which would be suitable for many patients. In the UK, we use many more high carbon inhalers than low carbon ones. We also have a high use of short-acting reliever inhalers containing salbutamol, indicating poor asthma control is widespread. So we have an opportunity to improve clinical care and lower the carbon footprint of care at the same time by prescribing and supporting patients to use more low-carbon anti-inflammatory preventer inhalers. On the face of it, this seems straightforward. However, the challenge is knowing how best to change practice, and importantly for our conversation today, whether to prepare a different approach if faster change might be demanded. For example, for gradual changes, we might focus on educating patients and prescribers and making small system changes to support them. This is what is happening now in England. But what if more rapid change was demanded? How would we achieve that? Options such as structural redesign, for example, creating bespoke community asthma services, or even regulation might be considered. We don't yet know the answer to this, but in Cambridge we're setting up a research program on very rapid decarbonisation of healthcare to answer this question. If we acknowledge that a bumpy future with sudden system shocks, moments of non-linear change and social tipping points is possible, or even likely, then we should be preparing for it. I suggest the best way to do this is to bring together planning for times of crisis with planning for positive change in our healthcare policies. In doing this, I hope we can turn threats to opportunities.